Hello, welcome to Discussing Fitchburg Now. I am your host, Sam Squailia. We have a very important show tonight that we are talking about, which is the proposed closure of the maternity at the UMass Memorial Health Alliance-Clinton Hospital, otherwise known as Leominster Hospital. They plan to close the maternity. And we have the Community United Coalition here to discuss this issue and talk about what we as the community can do and what the ramifications of these actions are. So I'm going to start with some background information. UMass Memorial Health, HealthAlliance-Clinton Hospital has filed with the Massachusetts Department of Public Health to close their maternity unit. State law in Massachusetts requires a 120-day notice of closure. They intend to close the maternity at Leominster Hospital on September 22nd, 2023. UMass Memorial Health, HealthAlliance-Clinton Hospital works and reports to the Massachusetts Department of Public Health. The determination of need law and regulation governs healthcare facilities, as that term is defined in Mass General Law. Under Massachusetts law, proposals for a substantial change in services, i.e. the closure of the maternity unit, must be reviewed and approved by the Determination of Need regulatory scheme. The Public Health Council of the Department of Health and Human Services accepts, reviews, and approves the Determination of Need applications within the Commonwealth. There is going to be a public hearing on this by the Department of Public Health on Monday, July 24th, 2023. The virtual public hearing starts at 5:30.
That's correct.
And the in-person public hearing starts at 6 p.m.
Yep.
And this is at the Doubletree on Urban Way in Leominster. So we have the Community United Coalition, which formed to attempt to share the information and organize the community here, our 100,000 residents or more in our area that utilize the services of the maternity at the Health Alliance-Clinton Hospital. And so we'll discuss what you've done, what the maternity has been looking like, and maybe what it's going to look like if we lose it. So I will start with Tara, one of our maternity nurses. Why don't you introduce yourself, and we'll just go down the table to introduce yourself.
Sure. My name is Tara Corey. I have been a nurse at Leominster Hospital for the past 8 years, with the past 3 spent on the birthing center through the pandemic. I was born at Leominster Hospital, and I gave birth to both of my children at Leominster Hospital as well.
And my name's Amy Gagnon. I'm a labor and delivery nurse on the same unit. I've been at the hospital for 12 years working there, and I run the hospital's neonatal resuscitation program.
My name is Irene Hernandez, and I am the co-chair to Community United, and I also had my children at Leominster Hospital.
Eladia Romero, I am the other co-chair for Community United. I am a resident of Leominster, and I also gave birth to my 2 children at Leominster Hospital.
And just to add, I was born at Leominster Hospital because they were striking at Burbank Hospital when we still had maternity when we still had a hospital in Fitchburg.
Yeah.
Right.
When we still had Burbank Hospital, we had maternity, but there was a nurses' strike for a number of months. And so I was born at Leominster Hospital as well. Yeah. So welcome, everybody.
Thank you.
So they proposed to close the maternity. The Health Alliance-Clinton Hospital proposed to close the maternity in Leominster right before Memorial Day weekend.
Yes.
Yep.
Right?
Yes.
Convenient.
The Thursday before Memorial Day weekend.
Yeah. So was the nurses in the labor and delivery, were you given any prior notification to this?
Oh, no.
No.
So we actually found out from a nurse at a different hospital. Another hospital had a meeting about it on how Leominster would be closing. And we were notified via text message, and then it got around to all of us. That eventually got to management. Management came to the unit and said, I'm here to tell you the unit is closing September 22nd. That is the decision. I am not answering any questions. And he did this with his hands per the staff that was on. I'm not answering anything. That's the plan. We were not told beforehand. We found out the same day that everyone in the community found out. None of the doctors knew beforehand. So everyone was very blindsided by this.
That sounds like a very corporate you know, for-profit kind of decision-making, you know, kind of scheme, right? Isn't that kind of what it would feel like if you were in a large corporation?
That's right.
But this is supposed to be a nonprofit community hospital.
Right.
Yep.
Correct.
Yep. And we should be serving the full community.
Yep.
And now we're cutting access to quite a bit of that. So.
So I was going to say, when the announcement went out, from my understanding, it was made to a limited number of people. It wasn't like it was a community rollout. It wasn't like they put an announcement in the newspaper or they, you know, went out and started telling the public. It was very strategic in terms of who they were notifying. So I believe the local legislators were notified, and not all. I'm not sure when the mayors were notified and city councilors, but some of the local elected officials were notified on that day. But it was not, we're announcing to the public that this is happening. There's been very limited communication between the hospital and the community in terms of this plan that they've proposed. Right from the very beginning.
And there was certainly no collaboration with the community a year prior to this.
No.
When they potentially thought that maybe because you don't make a decision before Memorial Day to close the maternity like that. This is a years-long process.
Or longer.
This is a multi-year decision-making process that they had to keep from the community, that they could have perhaps said, if the argument is, oh, well, these problems, perhaps they could have brought this argument to the community leaders, to the legislators prior to this immediate, you know, this is what's happening, we're not answering questions. They could have done that. They could have said, hey, we're having issues, can we work together? But there was none of that.
There was no conversation. The mayors in both cities, the legislators, councilors, senators, congressmen, no one knew. City leaders, no one. The hospital did not do any outreach, didn't do any focus groups. And if there was a problem, how about we fix that problem, because we get to have a birthing center in our community hospital, and that's an essential service, because without that, many will perish. So there was never a conversation prior to making this decision. We were all shocked. I started calling people. I said, do you know about this? Do you know about this? Nobody knew about this. And I said, listen, we need to meet next week immediately, because no one knew. And we need to figure out some solutions. We need to figure out what we're going to do. How are we going to organize? What are we going to do?
Well, thank God that our community has organized leaders like you to be able to mobilize the people and have this discussion, because I'm sure that, you know, the corporate structure thought that they could just slide this right under the radar, kind of like they did with the cardiac rehab when they closed that in 2018? Closing the cardiac rehab, they closed the pediatric service. Your baby, I mean, that was unbelievable then. And now that's just like a times 10 unbelievable factor to try to close maternity. But this is historically how you close a hospital.
That's right.
And it was very intentional that they announced it before Memorial Day, and then the entire process is happening throughout the summer. So people are busy, people are on vacation. So we, it was very intentional how they're doing this.
Yeah, they probably had some consultants, some high-paid consultants come in and go, here's how you close the hospital. Here's how you shut down maternity.
The same way that you did in Fitchburg at Burbank.
That's exactly what happened in Burbank. Fitchburg used to have a hospital.
And we had one of the best birthing facilities in North Central in Fitchburg.
I heard that.
Burbank was incredible for the birthing. Their emergency room was wonderful. People would go from everywhere, even from Leominster, they would come to Fitchburg to go to the emergency room back when it was open.
Yeah, but once they shut down the maternity, it was the slow, as Representative Higgins said, the 1,000 cuts. Yeah, the death by 1,000 cuts.
Yes.
So, but it starts with a big gash, and then, I guess it starts with little cuts. And then.
Right. And so I think what people really need to understand is that this is a greater problem. It's not just the birthing center. It's going to affect all of us in the community. And no one knows. We're still talking to mothers who are expecting to have their babies in October at Leominster Hospital.
And they don't even know.
They don't know. They don't know.
No.
And then we had a phone call from one of the elders in the community. She says, hey, what am I going to do for my annual pap smears? Because my doctor said that they're going to be leaving.
Well, why would any obstetrician, gynecologists, why would OBGYN stay in Leominster area if you have to travel 35 minutes to get to the hospital?
Right.
You wouldn't. You locate your facility close, adjacent to a hospital. So after it closes in September, we see a rash over 1-2 years. Maybe some people try to hold out, but they can't hold out for long. They close after a few years. Now I am a mother. I have no car. My boyfriend, my husband, he's got the car. I can't drive to Worcester, 45 minutes, an hour, park out there. I just choose not to go to my prenatal appointments.
Right.
Then we see worse maternal outcomes.
Yep.
Of course.
We
And
see
we're
worse
already
pediatric outcomes.
Mm-hmm. And we're already having poor outcomes in the BIPOC population. At first in North Central, it was the Ghanaian population, and now it's the Latino population with a higher infant mortality rate.
Yeah.
So what are you saying when there's a population density of many Latinos within the Twin Cities, never mind the surrounding towns, that use and access Leominster Hospital? It's the only hospital they know. What are we saying to them? That your life doesn't matter? That if you perish, you perish? That if you don't make it, you don't make it? My daughter was taken to Leominster Hospital in December of 2017, hemorrhaging, right? Via ambulance. And she was hemorrhaging. There would have been any time to stabilize her hemorrhaging, pregnant with my grandson, to send her to Worcester. If Leominster Labor and Delivery was not there, that birthing center was not there to perform emergency C-section and to save my grandson and to give my daughter 3 pints of blood, Sam, 3 pints of blood. And this is going to the hospital immediately. What's going to happen when they finally close labor and delivery?
We're going to see a lot more. We're going to see a lot more mothers pass away. We're going to see a lot more deaths that could have been prevented.
Right, and this is, as you know, I've been stating from the very beginning, one life lost is too many.
Of course.
There's no reason, and it's just not acceptable for a baby, for a mother to be put in harm in this way, for either one of them to lose their lives because of a decision like this. It just seems reckless. And at the end of the day, this group that we're referring to, Community United, which has a group of leaders involved, took it upon themselves to say, we need to notify our community because we do have young women showing up at WIC, or we have them showing up in our community not realizing they're not going to be able to give birth here in Leominster. They're going to have to travel and make arrangements. So, again, you think of a person who does not have access to transportation. It's hard for them to get to an appointment locally. Now you're talking about them getting treated in Worcester, which is how many miles away? I think somebody said 23 miles away, right? For
23 miles, which equates to maybe 45 minutes.
Right. And we're not talking about Ashburnham, Townsend.
Oh yeah, it's 45 minutes from Fitchburg.
Yeah.
Right.
And then I think a lot of this, it's not just the mothers and babies.
Yes.
My favorite part of, not my favorite, the biggest thing I've been focused on since the beginning is I think of my dad who works on the roads. He does road construction and he has a cardiac history. He drives Route 2 every day. He's gonna pull over, have chest pain one day, call 911 and think he's okay, they're coming. But now this is gonna tie up ambulances who are driving mothers to Worcester in labor for hours. So I've been trying to put it into words. If you love someone within a 30-mile radius of Leominster, you should care. This will affect you. Yeah. We will see the domino effect of this closure throughout this area for years to come.
The domino effect of the closure.
Yeah.
We're going to see, Fitchburg has advanced life support and basic life support ambulances. I forget the numbers, like 40,000 calls a year, right? So we have the ambulance services to handle the community needs that we have now.
And they're already burdened.
They're already burdened.
But we're stretched.
We are.
Very thin. Now you're going to take it, and we're going to take numerous. How many births? How many births are there at Leominster Hospital? 500.
600.
600 births a year.
Leominster happened 600, but there was 1,900 new births in the area.
Yeah, we could be doing a lot more if we had administration behind us and advertising for us and supporting us.
We have the capacity, we
Yeah.
have the room, we have a very large unit, and we could have done better. And we, as the nurses, have seen a decline in the births over the past few years, and we've come up with ideas. UMass is big on the innovation station where staff puts in ideas to better the unit, and we have one of the most active innovation stations in the entire UMass system, our little birthing center. And it was so hard to get any of those ideas completed because we've never had the support for it. They've never wanted to put the time and effort into us. We knew things were changing. We could see that our numbers were decreasing, and we knew we could make them better, but we've never had the support for that.
Well, when they proposed to close, and they did close, the cardiac rehab and the pediatrics, and there was a third thing that closed at Leominster Hospital.
Was it pulmonary rehab?
Pulmonary,
Yeah.
the pulmonary, yes. They closed, so when they proposed to close those, I heard a lot of stories that they were strategically cutting the staff, specifically to justify a lack of, a reduced number of service.
Yeah.
Yeah.
Do you feel like that is
Oh, yeah.
the case here?
Of course. So how many years ago was it that they did the RIF?
6 years ago, they did a RIF and did a
RIF?
reduction in force.
Yes.
Reduction in force.
Yeah, in the maternity center to accommodate the decreasing number of births. So we used to have, first it was 8-hour shifts.
Yep.
And then we went to 12-hour shifts, which essentially decreases the amount of nurses you need to cover the unit 24 hours a day. So quite a few nurses at that time took early retirement and left, and there was a huge change on the floor.
Yep.
And they changed the staffing model so that there was less nurses on at a time. And I mean, the labor and delivery unit it's just like an emergency room. You can't staff it because you don't know what's going to come in. Right. And that's always been a challenge, and that's
it's a full
challenge.
moon.
Right.
Yeah.
Snowstorm.
We might get a lot of births today.
And I think that's why maternity centers throughout the country are having this issue due to financial reasons, because they are hard to appropriately staff without knowing what you're going to get.
And they cost a lot of money because you need 24/7 PD hospitalists, 24/7 OB, where you could have a med-surg unit with 50 patients being run by one resident.
But the
So
issue,
it does cost a lot of money, but it doesn't mean we should shut it down.
But
You
the
have to
issue-
take a loss where you take some gains
Right.
for
The
the better
issue-
of the community.
when the administration came forward and they talked about this proposal, at no point have I ever heard that this is a financial decision. For me, I think we'd be having a different conversation if they were like, if we continue to have this unit open, the hospital will completely go, like we're in the red, like the hospital will go under if we continue to keep this open.
That's not the
hasn't-
argument.
We have not heard an argument about the financial aspect of this. It has been a lack of staffing, which, there was some information given that it appears that may not have necessarily been the case. A lack of OBs wanting to actually work at the hospital and wanting to deliver babies in Worcester, in like bigger, fancier hospitals. But there hasn't been a conversation about this is costing us so much money, we are losing it, we're bleeding, we have to do something. So that, even when we talk about it being expensive, they haven't pointed to it as it being a financial decision. And so everything that they've kind of put on the table are things, in my mind, and from what we've heard, and even I think from the community and maybe even the state legislators, I don't want to speak for them, but I think the mentality is these are fixable things.
Yeah.
Exactly.
Well,
These are
if you
things that
blame
we can
staffing,
fix.
that is a thing that we've been talking about for 2 years. Right? The entire community, when it comes to Burger King or Walmart,
Right.
it's staffing. There's a lack of staff. It's something that you can use and you can resonate.
Right.
So if you strategically unstaff
Yeah.
or reorganize,
Yeah.
The ref?
you
ref,
reorganize by not hiring, then you can justify that over a period of years.
You could justify it if it wasn't maternity and labor, because most of the nurses I know, that's where a lot of them want to work.
Yeah.
That's where you get the most applicants.
I mean, what's better than
It is.
babies?
Rocking
Yeah.
babies
And
every
you know
day,
what the
yeah.
other part is too? This is a woman's right.
Amazing.
Yep.
Where were our rights
It's a woman's
taken into
need.
Exactly.
It is.
Exactly. But where were these conversations? They never happened. And I think this is a greater concern. And the intersectionality of all of those who are going to be affected. There's going to be a car accident on Route 2. There's going to be someone with a heart attack. There's going to be somebody who broke their hip at home. And then there's 3 or 4 women coming in at the same time with birthing
because
concerns.
that's how it happens.
And that's exactly how it happens.
Yeah.
And then who's going to decide, Sam? Who's going to decide what ambulances and to who are we going to send them to? Because they don't have an unlimited supply of ambulances. Today, I can call while I'm at work at my health center an ambulance, and half of the times I can't find one. And this is between 8 a.m. and 3 p.m. There aren't ambulances available.
So we're going to have to hire new dispatchers that can be able to handle determining who lives
and
who dies.
It's called the God Committee.
Make this decision.
It's called the God Committee. Who's going to be making those decisions?
I've got 3 ambulances I need, and I've got 1 ambulance. I've got I got a level 1 trauma. I've got a hemorrhaging woman. I've got a whatever. Okay, who do we send it to? How do you make that decision?
Exactly.
And I think, I share my story because when the announcement of this closing, for me personally, it hit me just like a whirlwind, because I couldn't believe what I was hearing. But for me personally, it brought me back to, 9 years ago when I was having a pretty normal pregnancy. Everything was going fine. I was 31 and a half weeks. I started feeling some discomfort. I show up in the ER and they're like, you're in labor right now. We don't even have time to transport you to Worcester. You're having an emergency C-section like right now. And I think I'd say, if we didn't have labor and delivery, would I have been giving birth to my son in an emergency room? Like, would they have shipped me in an ambulance and prayed that I got to Worcester?
Would you have made it?
Would I have made
Would
it?
both of you have
Would
made
my
it?
son be here today? Would I be here today? There were no indications that I was going to have a complicated birth at all, that he was going to be born prematurely. It just happened. And I keep hearing this story over and over again from women who were like, I wasn't even due. I went into early labor and I showed up at the ER in labor and just had my baby at labor and delivery, and they were wonderful. People recognize the fact that it's needed. When you have the same way an emergency room is needed is the same way that labor and delivery is needed, because when a woman shows up and cannot be transported, I just don't understand the alternative to pushing her to an emergency room or sticking her in an ambulance and saying, okay, well, hopefully you don't have the baby on the way to the hospital.
Did we get transported to another country? Because I thought this is the United States of America. I thought we were in Massachusetts, the most educated state with the most hospitals, with the most highly desirable area to live in the country. And here we are, with our for-profit healthcare system, with our non-profit hospitals, and we are slowly, the death by 1,000 cuts, killing it off for what?
For profit.
Profit.
And the question is, what did your oath mean to you?
Oh, your Hippocratic oath?
That's right. What did that mean to you? When you sat there and you said, I will do no harm, right? I'm going to make sure I can save lives. So what does that mean to you? Where is your integrity in making these decisions? And for the Board of Trustees that sat on that board and that sat at those meetings, and
how did they vote for this?
Right, how did they vote for them? We want to set up a meeting with them because we want to hear from them. Because none of them spoke to the community, spoke to the legislators, to the mayors, to the senators, to the Congress. There was no conversation. I would like to know how they made this decision. And here's the thing, Sam. If there was anything happening in labor and delivery that was concerning, then we fix it. Then we find solutions. Then we add doulas, midwives, indigenous medicines, and we create the best birthing center in North Central Massachusetts. That's what we do. But taking it away from a whole population of people is going to cause a lot of deaths in our community. Many will perish because there's no health equity in our area. It's going to be a desert.
So let's segue here to quick what we can do. Can we put up the slide, Dan, of that shows the public hearing on, yes, that one. Can we put that one up on the main screen? So the Department of Public Health is having they are mandated to have a public hearing where they listen to the public, where you can physically go and speak to be on the record. And I would urge anyone who is anyone at all in the entire community, because you were probably born to a mother, You were probably born in a hospital. You should go to this hearing. It is Monday, July 24th. 5:30 p.m. starts a virtual public hearing. 6 p.m. starts the physical in-person hearing. It is at the Hilton DoubleTree Hotel, 99 Erdman Way in Leominster. And there, if you cannot be there and submit, to be there virtually or physically, there is a way to also submit your comments prior to 5:30 p.m. on Monday, July 24th. You have to submit your comments to the Department of Public Health. And we are trying to get as big of a people to speak out.
That's
because
right.
if the Department of Public Health, I don't know how much teeth they have.
Well, they get to have more teeth.
Because
they get to stop hospitals from closing. They get to have a more say-so because this is an essential service. This is a need that we have in our community, and the Department of Public Health needs to have more control over these decisions. There gets to be penalties put in place when things like this just, because right now, as it stands, hospitals can close whenever they want. They can make these decisions. They don't have to have a conversation with anyone.
And what has been so disheartening is when we have conversations with people in the community, first of all, who had no idea because the hospital has done a horrible job of communicating their plan to the public. We, in fact, have fact sheets in different languages so that people understand what's going on.
That was brilliant.
Because we have not seen it from the hospital, right? So why should we as community members be doing that? But because we care about our community, we want people to understand what is going on. But at the end of the day, people need to understand that their voice, they do have power. It is powerful when people show up in numbers. And this is when we had the community meeting, we wanted to give people the opportunity to come out. We wanted to empower them. We wanted to give them a platform, number one, to inform them so that they knew what was going on. And number two, so that they can actually have the opportunity to speak about what was concerning them, what if they had any questions, to be able to ask those questions. As a community, we were never given that opportunity with the hospital. And I understand it's a hard conversation because their decision is not popular in our community, but it doesn't mean that you don't get to communicate or correspond or even communicate with your community that you serve.
That you gaslight them.
You don't just...
You gaslight them.
Yeah.
That's a good word.
Yeah, and so we really want, we want everyone to come forward, and we want everyone to be able to have the platform and use their voice to voice their opposition and ask the hospital to reverse this decision. Because I believe, as far as I know, it's still a possibility.
Yes, today there was a public, a town hall virtual meeting where the decision is still the same, right? And we get to sign petitions, right? We have petitions online. There's QR codes.
Dan, could you put up that the other flyer? I think the QR code is on that flyer of this. Yeah, that one. Can you put that up on the main screen? So if you pause your TV right here, or your computer, whatever it is, you can take a picture of that QR code right there, and it'll pop up on your smartphone, and it'll take you to a link where you can learn more information and you can put your name to a petition to say that this is wrong and we don't want this in our community.
Everybody gets to sign up. Everybody gets to sign up. We want to close out this week by Friday with more than 10,000 signatures. That's the goal. We want to have 15 by Monday. Listen, we have the population. We just get to just sign up online. There's nothing. We're not asking for your 401k. We're not asking you, right? We're not asking you to vote for us. This is not about that. This is not political. This is about saving lives. This is about keeping essential services in our backyard.
Well, this is political. This is political. Well, it just spans all political ideologies. Because this affects all of us.
Everyone.
And to segue on that, even if you had your baby, you don't even have kids. You're not gonna have kids. This doesn't affect me. You're wrong. Because once they close that maternity, in addition to losing ambulance service, a few years down the line, people are gonna look at this community and go, "Oh yeah, I want to start a family. Where am I going to have my baby? Oh, the closest hospital is a 45-minute drive?
Correct.
Oh, maybe I'll start looking in another place to live."
Yes.
and we're going to start seeing out-migration from this entire area.
It is a gentrification.
That's what happens.
It is a gentrification of essential services. That's how they get those people, those poor people, those BIPOC people, those marginalized people. That's how they get them out. That's how they get them out when there's no access to health equity.
So that was suggested to me, was that, you know, we have a large, you know, Hispanic, Latino population here, and we also have a high low-income population.
That's right.
And, you know, do you think that that has something to do with the
Definitely.
closure
Oh, yes.
of
It's
maternity?
actually a nationwide problem where
The low-income areas?
where low-income minority populations are being targeted, and they're funneling the patients to large tertiary care centers to offset the loss of the cost of the loss, I guess, for running the unit.
Because
well,
they break even here. So just
Yeah.
the reimbursement rate right now for like Mass Health Medicare, they break even, right?
They're not making giant
Yeah.
profits.
This is, so when I went there and I had my private insurance, they made at least 4 times more.
Right.
Yeah.
4 times
Really?
more,
Yeah.
yes, yes.
So the higher income populations that tend to have private insurance, you're making more money.
Yeah,
Yes.
if somebody comes in with Mass Health from the time they're pregnant till the time of delivery, it's about $6,000 that the hospital makes. Whereas if you go in and you have Blue Cross and Blue Shield, it's $26,000 that the hospital
Which
makes.
is what I had.
Interesting. And you would think that that would matter for a private, for-profit hospital. That would make a difference.
but not
Let's-
a nonprofit.
But we're talking about a nonprofit hospital, isn't that
Community.
right?
Yeah.
A community nonprofit hospital that I am certain Burbank Hospital had it written into their, you know, originally Burbank Hospital was given, you know, by businessmen of the time, and said that it will always remain a public hospital for the people. And that kind of got transferred to Leominster.
Yes.
Transferred.
That's right.
And where are we now? Where are those promises kept?
The other piece of it is, I know there's been conversations about, because even in their own community assessments in the hospital, they have identified transportation as a barrier to accessing healthcare, quality healthcare, right?
Absolutely.
So I understand that they had designated a certain amount of money to transportation, to transport maybe people who don't have transportation, who might have issues with getting to Worcester. But the issue is, once that money runs out, which might be pretty quick, right?
Of course
might
it
be,
is.
you know, they'll
only
run out of it pretty
$1 million.
quickly.
It's gonna go
Right.
quick.
That's it.
And once it's gone, then what? Then who picks up the burden, right? Then
PT1,
who
Mass
is
Health.
PT1.
Right.
the
That's
transportation
a Mass Health
voucher?
code?
Yes.
Yep.
So then it's going to come back to the taxpayers, right? So the community hospital is paid by taxpayers. Now they want to eliminate a whole department, and that offset is going to come back on us again, right? Why? Why don't we just keep it open, improve services, and create that birthing center which you want? You want to make money, you want to engage more people, create a better birthing center. Create other possibilities. And I know that the nurses, you guys had so many great ideas about creating this holistic and organic way of having a child, of comforting the mother, of a family being a part of this. Why are we not looking at that? And then not just that, listen to this. If a woman goes to, and then you can talk about this, and because I get emotional about this, because this is where the concern is. So let's go back to the women and find out what happens when a woman goes there, she's hemorrhaging, and her child is born not breathing.
Right, so she will have nobody trained in that emergency room
Because we don't have pediatrics.
that knows how
We
to...
don't have qualified maternity nurse.
Right.
There will no longer be a pediatrician in the hospital at all times, which is a huge piece of this. As a mom and as a nurse, there will be no pediatrician in the hospital. They
You'll
are
have
leaving
a
come September.
General
Just the ER physicians.
general ER physician.
Yeah, the ER physician will have to serve as the obstetrician and the pediatrician.
That sounds like a difficult job for the ER doctors.
Correct. Who are brilliant at what they do, but I'm sure they don't want to be doing that either. There's a
And-
reason they didn't go into obstetrics.
And there's where the avalanche starts. You see that people are going to not want to do that job anymore
Correct. Yeah.
because they are seeing patients pass away because they don't have the right resources. So then
Or the experts.
And then the
So if a
experts.
baby is born not breathing, the team for just the baby is 5 people. That's how we
The
staff
blue,
our
code
floor.
blue.
Code white.
Code white as a
for
baby, not baby?
Or a
Baby not
maternal infant emergency. So we have 2 nurses, the pediatrician, the respiratory therapist, and the recorder.
Yep.
So that's 5 people just
Just
for the baby.
Never mind if the baby's
mom's
born not breathing and the mom's hemorrhaging.
And how many of those 5 people will we have when they close maternity?
One, the respiratory therapist.
1.
Yeah.
And what about the mother who's hemorrhaging?
Right. So the mother would need the obstetrician, and she would need at least 2 nurses and maybe a respiratory therapist for her. Probably more than 1 doctor.
Yep.
She's going to need the ICU doctor to come down. So it's just, it takes a huge team for an obstetrics emergency. And we are not going to have those resources in the hospital anymore. They are saying that the emergency room is going to start getting better trained in neonatal resuscitation, but that's
they
not.
are? Oh, they say that.
Well, they've been asking this one to train them. She is the one that educates for neonatal resuscitation, and she's not going to train the entire emergency room.
They also said when they closed maternity at Clinton Hospital that it's okay, Leominster Hospital is right down the street.
That's right.
You can have your baby at Leominster Hospital. Isn't that what they said when they closed Clinton Hospital, 4 years ago?
Yeah, when they merged.
I mean, I just think about it as a woman and as a mother. And I, living in this community, being a part of the community, and thinking that I will not, if I were to have a baby and something were to happen, another emergency, such as what happened with my son, and what's needed to save my life, to save my baby's life, is not available to me in my own community, and that they are going to risk my life, risk my child's life, is just like, I can't even process all of that. It is just, it makes me so angry, and it makes me so frustrated to think, this is what, like, as women, we are entitled to have safe deliveries. We're entitled to be able to go into our community hospitals, deliver our babies safely, and ensure that they get the proper care, that we get the proper care. And we can't even expect that from our own community hospital. When we were having conversations with people, letting them know what was happening, people were like, are you serious? How does that even happen? How can the hospital close labor and delivery? People couldn't believe it. And then once the shock kind of wore off, their next statement was, well, you know what? They're the hospital. They don't care about us. They get to do whatever they want anyways. How can
apathy?
But
There's
I'm
no
like,
accountability.
But I'm like, right. And people in our community to feel that way about their own community hospital.
Well, let me ask you, the people that, the administrators of the hospital, the trustees, they make these decisions, where do they live?
Correct.
How far do they have to travel how far do their children have to travel to go to the hospital to get maternity care?
Right.
They don't live in our community.
They don't live in our community. No. This is not going to affect them.
It's not. It's not.
One piece of this that has come up a few times on Facebook and in different meetings we've had is a population that we serve in this area, in any area, is we get moms that come in from the Suboxone clinic or the methadone clinic. So their babies are born withdrawing from these medications. So at Leominster Hospital, we have a program, the Eat, Sleep, Console. We do our best, and most of the times we don't have to use medication for these babies to withdraw from these meds. That is very specialized to smaller hospitals that can take the time and rock those babies for 5 days while they come down from those meds. And we have had moms come out and telling us, if you guys were not there when I had my baby, it would be a completely different outcome. My baby might have been taken away by DCF because the moms now can stay in the hospital after they've been discharged with the baby in the room, and they can take care of them, and we just oversee and assess those babies. If they're in Worcester, the mom has no way to get to Worcester. She's not going to be able to take care of that baby. And that is a huge, huge problem.
And there's a 51A filed now.
Yep. Right.
Because she's not visiting her child.
Yep.
So the intersection.
51A is a DCF thing?
Yeah. Neglect or abuse, right.
Neglect or abuse.
And I have to tell you, when I sat in the NICU with my son around the clock for 2.5 weeks, I heard those babies going through withdrawal and the crying. And what they went through, and it was horrific. It was heart-wrenching. And then to hear the nurses talking about, well, their mothers can't be with them, and these babies are on their own, so they're trying to find people to come in to hold them. And as she said, they have that available here. Like, it's a smaller hospital. They're able to then, support this baby as they're going through it. And I tell you, I don't think there's anything more heart-wrenching than hearing a baby cry, like the screech of them going through withdrawal, and it's just continual.
My brain is blocked it out.
Yeah, it is. It is. I know, and it is, and that's what and so, you know, to bring up that point, you know, for babies to be able to have, you know, again, what they really truly need. And not to say the NICU in Worcester is not fabulous, they are, but we have the ability to care for them here.
But transportation is a huge obstacle for people of you know, lower income.
Even here right now.
Yep.
Even getting to Leominster Hospital is difficult for a lot of people.
Yeah,
and that's 7 miles away.
And even in Leominster Hospital emergency room, they are not equipped. There are people that are lined up in chairs. People send me pictures. Hey, I'm sitting here in the emergency room in a chair in the hallway. They have these group of people with mental health over here closed up, and then there's chairs lined up around there. The more violent ones are inside the room. The other ones are outside the room. So you're telling me that an emergency room who is already past capacity,
stacked to the gills, where people are waiting for multiple days in the hallway.
And then what's going to happen to that woman when you're having a birth, when you're having your child, even if it's a natural birth, everything's great. Hygiene is everything. Hygiene is everything. What's going to happen when you go into the emergency room?
And what if there's no room? Like, they keep saying we're going to put them in room 1 to deliver the babies. We'll have the baby warmer in room 1. What if there's a patient in room 1?
What if there's a trauma going on?
Are they going to be in the hallway? Like, what are they going to do?
And so room 1 is where they're going to deliver, and room 2 is where you have DOC with a prisoner who's getting care in the next room over. And then room 3 is where someone's having a mental crisis and they can't find a bed for them because there's no beds for them across the state.
And then you're going to have nobody that wants to work in the ER.
And I mean, I went to the hospital and I was in labor for 72 hours, and I was walking around. And I'm like, okay, walking around the hallway.
Right.
So now I'm walking around the ER?
Yeah. And
is that what I'm in labor?
You'll be denied access to an epidural because they're not going to be ordering epidurals down there.
You won't get an epidural in the ER. Ooh, that sounds painful.
Yeah.
well, that's why we're pushing so hard, because this is complex. This is not just, there's so many different intersectionalities, so many concerns, so many issues, so many possibilities, right, that we've already seen in other hospitals. And now you're purposely doing that in our community hospital?
And we have a strong community.
We
are willing to work together to, like, get through this and make this a better place to be.
Right.
That may be the difference in all the other cases, like, not saying against anyone else, but we have a strong community, and we have a strong group of nurses and doctors in the hospital who are also willing to put in the work for this. We can change this. Like,
and
this
nobody
can be
wants
changed.
to leave. Once they announced the closure, they pulled 14 travel nurses out of their butts. Just magically appeared. We have no staff. We're closing you. Now all of a sudden we're overstaffed.
Well, what does that mean? I don't get it.
So travel nurses are temporary nurses. They pay them a lot of money to come in and cover. We had 4 holes between the 2 sides. People were picking up time. We maybe could have used 3 travelers to cover all the holes through the summer. They hired 12 the week after the closure announcement.
Why did they hire?
Because they thought we were all going to just
jump ship,
leave and not complain and not fight.
But none of us have left. We're all still there.
That was probably from the high-paid consultants that they had. This is what happens in other hospitals. We've closed across the country. This is probably what's going to happen. So this will be the next step.
No, we're
all fighting, and we all want to stay open.
And this is the thing. You know, they give. You know, there were about 600 births, more or less, at the hospital, I guess last year, whatever the case is. And I don't know what fraction of those people had a negative experience, but I have to tell you, the majority of women that I encounter that say that they gave birth in Leominster, I gave birth naturally. My daughter was great, my son, emergency. And in both cases, the whole process for me, there were no complaints. I was taken care of very well when I was in Leominster in both scenarios, in both situations. And most women that I encounter will say the same thing. The level of care that we receive from the nurses and the support and the care is tremendous. They do go above and beyond. And clearly the fact that they're still here shows their dedication, not only to the unit, but to our community. And so there is the possibility with the community working together, with the nurses, with the hospital, for us to be able to create, to fix whatever issues the birthing center might have, make it better, improve it, but getting rid of it is just not the answer.
It's not the option.
So what can we, the community, do? Well, we're educating ourselves. We're watching this program. We're listening to the stories. We are fired up. We're mad. Yes. What do we do?
We have Facebook.
We need everybody to go on our Facebook page, Leave Labor at Leominster, and sign the petition.
Can we put that, Deanne? Can we put this graphics right up on the main screen again? So this QR code right here takes you to the petition.
So the Facebook page, you can just search Leave Labor in Leominster.
Leave Labor in Leominster.
Yep. So that's a group of us nurses from the unit that are keeping the public updated. We post all of the media that does coverage for us. We will post about any events on there, and we invite people to share their stories of the birthing center, and we can help coach them on how to submit that to DPH, and we will try to share their stories as well in our own testimonies.
And we need as many people as possible to show up for us Monday night. If you don't feel comfortable speaking publicly, you can write written testimony and submit that.
I see that there's yard signs.
Yep.
Yeah.
Yes.
There's
So we
the
have
articles.
Yes.
It's talking about the DPH
If anybody wants
hearing.
lawn signs, if businesses want banners or signs, let us know. We have many. We have the paperwork and the information in 4 different languages. We have English, Spanish, Portuguese, and French. So we just want everybody to know. So our charge and our ask of our community is to go out, talk to your neighbor, talk to your son, talk to your grandson, talk to whomever it is, your father, your mother. Everyone gets to get involved. This is going to impact all of us in our community. It's not just women who are having children. It's not just a child who is born not breathing. This is going to impact us all. So they get to put signs up on their lawns. They get to show up to the public hearing on the 24th at 5:30. Get there early. Sit down. Meet your neighbors. Bring your grandparents. Bring your children. Bring your aunt. Bring your sister. Bring your husband. Bring whomever it is. Bring your partners. But show up, because DPH needs to understand that they need to have more of a say-so when these decisions are being made for community hospitals and essential services, which is this hospital. Labor and delivery in our communities in North Central Massachusetts is an essential service. I get fired up.
I agree with you, Irene. I mean, I'm mad.
Yeah.
I'm mad.
And administration has time right now to reverse this decision.
They can change this decision.
I don't think they were expecting people to get as upset and worked up as everybody is. They can turn this around now, and we could make a huge...
And they could work together with the community, and we could all push.
But from what we've heard, they don't understand why there's so much pushback. They have come out and said, we don't understand why so many people are so upset about this.
I mean, I live in the community over here, and my daughter is, right down the street from the hospital, and she's just fine. So why do you guys care?
Right. Right. And I'm like, well, we're telling you why we care. That's why we're doing all these.
Yeah.
But that is, again, the fact that they don't understand why we're all fired up and why we are so passionate and angry about this just highlights, again, the lack of communication, the lack of them coming out into the community and listening to the community. Them making a decision and then saying, well, why are you upset about it? Well, have you engaged with the community? Have you had conversations with the community? Have you heard their concerns directly? No, you have not. So if you really truly want to know why people are fired up, you truly want to know why people are angry, you know what? Then you have a conversation, you have a dialogue with the people that you serve in your community.
Listen to us.
Have a listening session.
When did the Board of Trustees reach out to their community? We have nonprofits on the Board of Trustees.
What are they doing there?
What are you doing there?
What are they even doing there?
Because if you didn't take a stand against it, then you're complicit.
That's right.
That's it.
That's how it works.
That's it. If you didn't agree with it and you stayed, then you're complicit.
Yep. If you remain silent, you're complicit.
And I was struggling with this today. I had worked last night and I slept 45 minutes this morning. And then we had another appearance, and then I went home to sleep and I could not sleep. And I'm texting my friend and I'm like, I can't sleep because I'm worried about all these lives that I want to save. How are these people going to bed every night? How are they like sleeping? How do they even get up in the morning?
On a big bed of money with many beautiful
I mean,
women.
it is, and I speak for all the nurses. We have all struggled with this since it was announced because we know the dangers, and we are all struggling to like cope and get through this. There's a lot of tears. There's a lot of sleepless nights. I mean, it's bad. We are like
we're all
this.
getting laid off. We don't care about our job. Like, we want to stay there, but we're going to be fine. We'll be able to find other jobs. It's the community we're worried about. We're worried about what's going to happen to our patients.
And also, let's talk about the other area hospitals that are probably already overburdened themselves.
As well,
Which they
So,
are,
Gardner has maternity?
Yes.
Does Athol Hospital?
No.
So, okay, so you're in that area, you go to Gardner.
Yep.
We have Emerson Hospital in Concord, which is an hour and a half away in rush hour traffic. And Worcester, which is the same.
Yep, busting at the seams.
Hour in rush hour traffic. Gardner, what? I don't know, 35 minutes?
But let it be rush hour traffic too, because we have more residents now than ever.
So you've got you got 3 hospitals realistically that we could go to. So that's 600 additional births combined between what? Probably less people at Emerson than probably Worcester and Gardner, right? So
But let's say you have
that's a lot of additional births.
But let's say that you have an OB here. Like, let's say just kind of getting into the OB situation. There'll be some who have been here for a really long time delivering babies, and this is, they're kind of anchored into our community. Well, you're attending with that person throughout your pregnancy, but then you have to go to Worcester and give birth, and what if that OB is not traveling to Worcester with you? So now some random OB in Worcester or Emerson
who hasn't,
knows nothing about you, is now delivering your baby after you've been with the same attending physician or OB throughout your pregnancy.
And during your pregnancy, they have you meet all of the doctors in the office. When I was having a baby in Leominster,
it could be any one of these.
Right.
But
and it was
everybody.
Nice. It was nice to know.
But they have you meet with each one of them at different times in your pregnancy, in your appointments.
Right. So if prenatal care actually does stay in Leominster, that's not going to happen.
No.
Right. So you show up in, let's say you show up in Gardner, or you show up in Worcester, whatever the case is. You're going to be delivering your baby with someone you've just met. You've just met.
That sounds very corporate.
That's what I'm saying. I'm like, this does not feel like a community response. This does not feel like a community hospital when the way that you're treating it is like a transaction. Like, this is just a transaction. You're going to go to the hospital at this particular point in time, and you're going to deliver, and this is where you're going to go, and you're going to travel. And it's very like systematic. It almost feels like there's no empathy. There's no consideration for women in any of this.
Well, there's no regard to life.
Yeah.
No.
In other states, you've got to travel it's very common to travel 1 hour, 2 hours to get to the nearest hospital. And
that's why we don't live there.
I thought we lived in Massachusetts, right? The most educated.
And we also
one
know
of the most expensive states to live.
Yes, and we also know that from that 1,900 new births in our area, that segments of our population, of our BIPOC and indigenous populations, were sent to different hospitals. Oh, this groups go over here. These go over here.
How is that?
It's
insurance.
Insurance.
I mean, it could be a bunch of things, but there's 1,900 births. 1,900.
So what are we going to do when it closes and then, UMass Memorial tried to buy Haywood and Athol, right? And what would have happened there? We shut that maternity down.
Yeah.
Then we shut Leominster down.
We're creating a maternity desert.
Yeah.
Yes.
And then do we funnel everyone to a super mega hospital in Worcester?
That's
in
the trend.
Right.
So I want to be clear as well, because I know in a lot of the outreach that we've been doing with Community United in the group that we've been working with, we've heard a lot of, there's no point in advocating. The hospital's made the decision, they're going to close it anyways. But we remind folks that we're coming from a position of they still have the ability to reverse the decision. And so we're going to continue to advocate, and we're going to continue to make it clear to them that that is what we're asking. That is what the community is asking. So we're not, I have to say, like, from the conversations we've had, we're not at the point to say, right, like, okay, they're going to close it and now what? No. It's, well, you know what, we're not at that step yet because they still have the ability to reverse the decision.
There's still time.
It doesn't. It's not like final. Like, okay, it's September 23rd, and now it's a done deal. Like,
the Department of Public Health has the final authority to say that's why they're applying for this determination of need. And as far as I'm concerned, I mean, and as far as the majority of the community is concerned, there's a need.
Of course.
But so
the Department of Public Health is going to say that this is an essential service. That's just, they are. They're going to say that. That just makes the hospital have to go through more steps, but in the end, they can still close us. They don't have...
There's no teeth.
There's nothing they can do. So there are things in the works in the State House going on behind the scenes to bring up new legislation that would not let the hospitals have the final say. Unfortunately, that's not going to help us by September, but hopefully that will help the future of healthcare in this state. However, we need to change their minds. We need to show them that this can't happen. The community is together, we stand together, and we don't want this to happen. That's the only thing we can do. So we have to join up as a community and be strong.
And then after the hearing, I believe it's 15 days, right? DPH will come back with their information.
Yeah,
ruling.
and they're going to say we're an essential
It's essential service, right? And then it will be up to the hospital to then present their, I guess, their next step or their plan at that point in time.
So how do we convince the hospital that this is the wrong decision?
People have to keep showing up.
And you need to make the right decision.
We have to keep showing up. Just like the folks at Newview, the Spanish American Center, Three Pyramids.
Yeah.
I mean, there's so many, some of the Sally
Coalition on
Cragen,
Health.
Joint Coalition on Health. So many folks are like running everywhere, and so it's not Eladia and I. We just happen to to be here right now. Yeah. This is a coalition. We have folks running everywhere. We even have an 82-year-old woman. An 82-year-old woman who gets in her car every day to collect signatures, to send out flyers, and to talk to different people. And even today, she went to meet with a Portuguese-speaking business owner and brought him some information so we could really do more outreach. 82 years old, and she's running with her head cut. They can't take this away from us.
82 is the new 72.
It is. Yeah. But I'm just saying, though, she's showing up. And she's showing up with all her heart and with all her passion because she knows that essential services get to stay in our backyard.
So all of us can show up and speak out and reach out to UMass Memorial Clinton Hospital.
Yeah, and we have the list of the Board of Trustees. We have all their information, and then you can see, what businesses,
what businesses that they
and nonprofits,
what businesses, what nonprofits.
And I think our community gets to know that, and we get to call them. We get to call them and say, hey, why did you make this decision if you're a nonprofit? Hey, why did you make this decision if you understand?
Why am I supporting you guys when you don't support our community?
And this other business, and this bank, and this, when you say on your mission that you are all about equity and blah, 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 right? Because it's just, words mean nothing at this point. And then you're going to show up and make a decision where you're going to jeopardize the health of our community and possibly your mother if she's here, right? So it has to be real for them. And I think the only way it's going to be real is if we start reaching out to them. So the community at large, legislators, business owners, community members, like this 82-year-old woman who's out there, like, she's lighting up.
Because this is going to affect everyone here. It's going to affect businesses. Yeah. It's going to affect houses. It's going to affect cities. It's going to affect everyone. In the domino effect.
Yep.
Yes.
Yeah. So we have 30 seconds left. Is there anything that we want to make sure that the audience knows?
Hit it.
Tara?
Let's go.
Ladies.
Show up Monday.
Show up, stand with us, fight with us.
Everybody that's watching, bring 10 people with you.
Yeah.
We have flyers, banners, communicate with us. Let us know what you need. Get the word out. Bring your grandmother, your father, your brother, your sister, your children, even the great-grandchildren. Bring them with you. Yeah. Bring them with you, because this is a time that you get to show up with your family.
And have your voice heard. Have your voice heard and demand that DPH listen to our community and, with the hope that, again, the hospital will ultimately reverse this decision.
All right. Thank you, everyone, so much for all the hard work that you're doing
Thank
to
you.
save our community hospital. Thank you for watching. Thank you for all that you're going to do to, save our birthing center at the Leominster Hospital. All right. We'll see you next week.